Hi, and welcome to the Addiction Recovery Place, the podcast champion addiction treatment specialists and experts around the world. I'm very pleased to introduce today's guest, George D'Artagnan, PhD. George is a social researcher who conducts field based research with people who use drugs, including the non medical use of pharmaceuticals and injection drug use, and amongst marginalized as well as structural advantaged people who use drugs. He's interested in alcohol and other drugs, the sociology of crime and deviance, and social and cultural theory. He advocates for non-carceral in responses to drug use, with particular focus on harm reduction. He is also a senior lecturer in criminology as part of the School of Law, Society and Criminology, and the Faculty of Law and Justice at the University of South Wales. Welcome to the Addiction Recovery Place podcast, George. It's wonderful to have you with us today, and we really appreciate you joining us.
Thanks so much for having me, Chris. Yeah, really excited to be here to discuss some of the work I do at it's actually the Uni of New South Wales.
Oh, I beg your pardon. Didn't I
Good.
say that? Okay. Okay. Well, I beg your pardon on that. Anyway, so we're going to jump straight in, George. So tell us what drew you towards this subject and around your work.
I think that I've really had a strong interest in underdog type stories for most of my life, and I think that
Mm,
mainly comes from my family's migrant history. My family have lived in many different parts of the world over the last few generations, from Ottoman occupied Armenian villages.
mm,
They had to leave in the 1910s because of the Armenian genocide. They resettled in Palestine and then were displaced from Palestine during the Nakba in 1948 um, through the establishment of the State of Israel, then to Jordan, then because of civil war there, had to move again. And they landed in a Gamarigal country in what we now call Australia in the 1960s.
mm,
And so for
mm,
me, whenever I hear, people who are just struggling for a good life or to make something to make to make it, I suppose, in what is sometimes a cruel world being put
mm,
down,
mm.
it feels unnervingly familiar to me.
Yeah.
And so, there's these really interesting things that go on when, I arrive here on stolen country, and and end up in more or less a middle class life. There are these kind of really interesting survival tactics amongst people who struggle, who draw lines between themselves and other people who are worse off than them. And I think drugs is one of those lines that people
Mm,
draw a lot, and that's
mm,
where I think it brings back the interest comes back for me. So, there are
mm,
some really interesting double standards around whose drug use is good and whose drug use is bad. And I find that really interesting. But I think more importantly, I have a really strong inclination to kind of interrupt that kind of thinking. And
mhm,
that's really where my interest in drug policy and the lives of people who use drugs come in.
mm. That's a very good explanation of that, and thank you for explaining that to me. So, what work and research do you do at the university, George? What do you currently do?
So I'm a qualitative field researcher who works primarily in street-based drug markets and with people who use drugs. And
Mm,
basically, what that means is that my job is to spend time with people who use drugs in all sorts of settings, but in drug markets in particular. Uh,
mm,
so that means hanging out with them, speaking to them, learning about their lives and how prohibition affects their lives, as well as, other ways that they kind of deal with and manage um, drug use and prohibition.
mhm. Okay, so how long have you been doing this work for with specifically around drug use and prohibition laws and the research you've been doing?
So I've been a researcher for the last 10 to 15 years,
Yeah, of
depending on whether you count the PhD as part of that
course.
of that process. So, about 5 years
Mm,
of the PhD, then 10 years after that.
mhm.
And I also do I teach in criminology at the
Yeah,
university.
yeah. Excellent stuff. So within your research, George, what period of time was the linchpin of when things were really ramped up in terms of international consensus to punish drug use? Because it's such a wide subject and there's a lot more history than I realized. So if you can tell us a little bit about that, about the history around drug use and prohibition and how that came to be.
Yeah, well, I mean, I think the timeframes, are sort of slightly different in Australia and North America, but there is something
Mm,
that kind of binds those 2 together, and it's
mm,
really colonization that begins the process of strong restrictions around, drug use,
mm,
or the drug use of particular kinds of people, First Nation people. So, like during early colonial eras in both North America and in Australia, there was kind of direct targeting, racial targeting in legislation. So, naming populations of First Nations people as, being their drug use being restricted.
mm,
And that includes in North America, people who were enslaved to build the New World, and in Australia to build a new country.
mhm.
Um, but that isn't, of course, where it stops, right? So that's the
Yes.
sort of inception.
Yes.
Um,
Thank you.
and there's a kind of slow progression over time of restricting more and more substances for more and more people,
Mm,
around that begin there, but grow from there. And I think where it kicks into sort of high gear on the international stage, is during the Nixon administration in the
mhm.
US, which is the first administration to use the war on drugs language.
Yep.
And it's really the establishment of the drug interdiction agency, that you still have today. Those kind of agencies that are focused specifically on finding people who use drugs. So entire agencies devoted to that. That really ramp up the war on drugs in America. And
Mhm.
in Australia, actually, the time frame and the politics are quite different. Australia was much more ambivalent and reluctant to actually introduce prohibition, and it resisted it for much longer than other places.
Oh.
But eventually, especially in the 1970s, began to embrace it with much enthusiasm.
Mhm. Along with the rest of the world, unfortunately, I think really as well. In the United Kingdom, I think we had our main drug law was implemented in 1971. So the kind of history around the drug laws is far outstretched, and everything's just ramped up constantly. And then obviously we had the Reagan years, and Clinton and everything else, and here we are today dealing with this big mess, unfortunately. So with the so-called war on drugs, do you agree that this is the wrong framing of the term? Because my personal opinion is that it's a war on people and used to control certain demographics in society, sadly. Um, as your study and paper, The Coloniality of Drug Prohibition clearly details. Everyone has to read that, by the way. So,
Thank you for reading it. Yeah, I mean, you're absolutely right. There's been lots of ways in which people have challenged that phrasing. So, there's been people who've historicized the war on drugs as uh, a war on black and brown people, or
yes.
a significant form of racial violence, a war on poor people, a war on people who use drugs. So just
Mm,
communities of people who use drugs. I
mm,
think all of these kind of reframings of the war on drugs are really useful. They're all true, but as I said, I think it's important to mention that the inception of these things is colonial processes and in colonial imperatives, right? It
mhm,
was really useful for imperial powers to present um, Indigenous peoples as savage in order to kind of conduct processes of colonization, and drug use was one of the ways in which they did that. And so, that's a really important form of kind of social control, um, that operates today. But there are really kind of much more contemporary examples of the war on drugs being explicitly a form of social control. So I mentioned the Nixon administration, right? The one that sort of
yep,
started that actual terminology, the war on drugs, which didn't
mm,
exist before then. And
mm,
Nixon officials have been quite explicit about admitting that they knew that they would be lying to people about drugs and drug policy when they began the war on drugs, and that they did it for the explicit reason of trying to interrupt the communities that were at the time their greatest political threats, and that was anti-war protesters and African American or Black communities that weren't supportive of them. I mean, people from the Nixon administration sort of openly discuss that
mm,
now, right? Saying that
mhm,
actually the reason we did this was so that we could invade the homes and lives of people who are anti-war and people who come from Black communities. That
mm,
was the explicit reason they made that kind of political calculation to use
mm.
that term. And of course, we see the expansion of that. ever
Mhm.
since.
Yes, because the whole policy, I believe as well is it's changed the world as well, and kind of how we see people and communities, and it's I've worked in the field for quite a while, and seeing the repercussions of drug laws, and you know because it's not just somebody gets arrested, prison, and that's it. They get on with their lives. That's their life completely ruined in certain states. Because I mean, we have it over here in America now. If you get done for a drugs offense, you can't vote, you can't get your housing,
Mm.
you can't get loans. Bank. There's such a big implication of somebody being arrested for drugs, and it seems to have just been ramped up significantly over the last 40 years. Um, You stated, George, that you're a champion of non-carceral approaches to drug use, which I completely agree with. Can you fully explain what this means and how it should be implemented into a wider society instead of the tried, tested, and most importantly, failed models such as just punishment?
Yeah, I think, non-carceral approaches to drug use are basically approaches that support people to use drugs as safely as possible, or,
Mm,
or to support them in their goals related to their drug use. So,
mm,
it's important in these spaces that we don't kind of um, collapse everyone into the same category, right? Lots of
mm,
people have very different relationships with their drug use. Some people really want to stop using drugs, and we should find ways of supporting them to do that through non carceral responses, as in, like, without imprisoning them
mhm,
or without policing them. Or without sort of requiring abstinence as a sort of first step, which is kind of a bit of a bizarre thing that some of our health systems kind of require. They require you to already be abstinent in order to enter programs that are based on abstinence, right?
yep,
And that's really hard for a lot of people, to sort of manage their lives when they're sort of abandoned by all sorts of social systems, and also, other forms of social support, like even their families, right? Lots of
mm,
people who use drugs or become dependent on the drugs they use are abandoned by their family for reasons that are not their fault nor their family's fault. This is about the way prohibition stigmatizes and criminalizes people. It
mhm,
forces people to the edge of society. It forces people to be criminalized, and that creates tension between young people and anyone on the age spectrum and their families, the forms of social support that they need to kind of get through the day to make a
mhm,
good life.
yeah,
And so what we do need is approaches that support people to their goals, right? So if your goal is to stop using drugs, then how can we support people through doing that without imprisoning you? And that's
mm,
a really important point. And it's
mm,
something that I've been exploring actually with people with people who inject drugs at the
mm,
Sydney Medically Supervised Injecting Center, where I've been doing some research. And
okay,
they talk a lot about how, prison for some people who use drugs is a chance for them to moderate their drug use, right? It ends up being an opportunity for them um, to change patterns of drug use. I mean, that's not the case for everyone, of course. Like it
of
can be
course, yeah,
really very harmful towards people's patterns of drug use. But for
mm,
some people, it does provide that opportunity.
mm,
But the longer you speak to people about this topic, the more you realize that police and prisons aren't the ideal place to moderate people's drug use. They're not ideal. They cause harm in the way people are arrested, in the
yeah,
way people are closed off from social and familial networks. Like I said, being imprisoned is a really significant stigma that places distance between people and their families and other kinship networks. Right. So yes, prison can provide an opportunity to moderate your drug use, but
mm,
it's not the best way to do that. And it does
yeah,
cause harms along the way as
mm,
well.
mhm,
So that's one kind of area. The other area is that not everyone who uses drugs wants to or needs to stop their drug use. That's a sort of huge area um, of the drug use space that we really don't talk about that much, which
mm,
is that some people uh, can and should be able to manage their drug use without being criminalized as a result of that drug use. And where they experience harms, they should receive health and social supports to minimize those harms, right?
mhm,
That's what
Yep.
we mean, or that's what I mean anyway, when I say non-carceral responses to
Mm.
drug use.
Yep. I totally agree with that. So, just a bit of an offshoot, but why do you think alcohol and the rest of the drugs are treated so differently? Because alcohol is so accepted the worldwide, and you know, it's literally accepted, but it's one of the most damaging substances you can actually use, I suppose. Really, why do you
Yeah,
think that is?
there are these long social histories of
Yep.
alcohol moving from stigmatized and prohibited towards very accepted and towards more regulated. Australia has a long history of this. Australia came really close to doing prohibition of alcohol in the way that it was done in the US, and that was largely driven by temperance movements, who sometimes I thought it was kind of the first wave feminism, who at the time linked, alcohol consumption to domestic violence and the
Mhm.
harms that that caused. And there's long histories of what happened when Australia came very close to prohibiting, but then shifted towards an approach that was restricting the hours where pubs
Mm.
um, could serve could serve alcohol um, uh, until about six p.m.
Yep.
And there was this very unintended consequence of people rushing from work to drink as much alcohol as they possibly could before 6 p.m. They call it the 6 o'clock swill
Right.
in Australian sort of history. And it did not address violence and, of course, increased violence as a result of it.
Mm.
So that happens at a time when there is increasing pressure, or not at the exact same time, but there are sort of
Mm.
parallel movements for, in Australia's case, kind of the oh, sorry, my lights have just gone off. The
It's okay.
the colonial power that is the British,
Mm.
really pushing the need to criminalize drugs. So
Mm.
substances that were available for widely available for use are becoming more and more restricted,
Yeah.
um, while alcohol then becomes the sort of legitimate drug that becomes less and less restricted in order to respond to some of those things. So there are lots of kind of parallel histories between these things. So when some drugs become less available, other drugs become more available.
Mm.
And I might maybe it's an under analysis of the situation, but it's an accident of history in many ways that at the time when things were being cracked down on, this drug is the one that was um, being loosened regulation,
Yeah.
being that we saw regulation loosen on.
Just seemed a lot more accepted. So, mm. So you're a big supporter of harm reduction, George. So what harm reduction approach do you see as the best model the world should implement, and why do you think this is?
So I'm really strongly influenced by people like Mariam Kaba and Shira Hassan on these kinds of questions about, like what should harm reduction look like and should it be? And for those who haven't heard of Shira Hassan's book, Saving Our Own Lives, I really highly recommend it. She really explores the kind of activist origins of harm reduction, the mutual aid origins of harm reduction, where it wasn't actually just about drug use. It was about communities of people who had been abandoned by social systems. We're talking here about um, trans women of color. We're talking about people engaged in street based sex work. We're talking about people who use drugs that intersect with all of those uh, dynamics. And really, it's about these communities developing strategies to keep themselves safe from state intervention and policing.
Mhm.
And it was this kind of harm reduction that developed some of the most innovative public policy, or the origins of some of the most innovative public policy that we see today in the more contemporary or mainstream harm
Mm.
reduction services that we have now. And so the question that Hassan poses, and the one I think is really useful, is how do we make harm reduction a liberatory project?
Yeah.
And what kind of harm reduction helps to liberate people who use drugs and also other people who have been abandoned by social systems to live happy, healthy, and fulfilling lives. That's the kind of harm reduction I think is the most important, um, and that is compatible with lots of contemporary harm reduction services like
Sure.
um, the the Safe Injecting Centre here in Sydney, like needle and syringe programs, like overdose prevention sites.
Mhm.
But it does present some really interesting questions around, for example, when you are talking about liberation and interrupting state intervention.
Mm.
Um, what does that mean when you have a government service that runs um, a harm reduction service, right? The
Mm.
presence of police
Yeah.
is really harmful to people who use drugs. And so, is it ever appropriate for harm reduction services to allow the presence of police or to work with police, even if in strategic ways? These are
Mm.
really important questions that that I think we need to start thinking about and grappling with around what's the best way to do harm reduction.
Mhm. So how long have you had safe injecting places where you're located in Australia?
For over 20 years now. So,
Really? Wow.
yeah,
Wow, that's impressive.
Sydney's had one of the longest running medically supervised injecting centres in the Southern Hemisphere. And we've had another established in Melbourne a few years ago. And there's
Mm.
talk of another in Melbourne coming along as well. Um, this facility largely operates on the basis that police aren't supposed to come onto the premise,
Mm.
and they're not supposed to arrest people and those kinds of things. And one of the reasons this works is because there's exemptions in legislation to say that clients and staff um, shouldn't be or can't be arrested.
Yeah.
For example, um, it doesn't work quite that perfectly in practice. There are many reports of police, in my own research and others, of police hanging out at the front and at the back of the injecting center, of the way that they police the area where the injecting center is located, and all of those
Mm.
kinds of things. So
Mm.
many issues still to deal with, but
Yeah.
nonetheless, a really fantastic service.
Oh, definitely. Would you say that it's an amazing harm reduction approach, but has there been a notable reduction in bloodborne viruses and HIV and all those, very important things that you have to be very aware of when you're injecting any drugs?
I am not an infectious disease specialist, but it doesn't
Mhm.
take a specialist to
Yeah.
look at what the figures show in Australia,
Yeah.
which is the harm reduction approach that Australia has taken has almost completely eliminated HIV in the population in Australia. Not completely, of course, but it
Yeah.
is very, very low. And that is to the credit of communities of queer activists and organizers and communities of people who use drugs
Yeah.
who have really championed harm reduction and mutual aid as a way to help each other um, reduce the spread of this virus
Yeah.
and almost eliminate it.
That's wonderful to hear. That's great. And it's very progressive. I mean, even in the United Kingdom, we don't have this. They were fighting for it even in Scotland, and it never happened when I was living there. And it's wonderful to see that some countries are actually, taking part in this important program because it's, something needs to be done to address this problem for sure. So what role does recovery play in the future of drug policy on the non-carceral approaches that you mentioned earlier, George?
I think recovery plays an incredibly important role. I think sometimes when you're working in the spaces where I work in and you're taking, critical perspectives, like I do, people think that you don't take recovery seriously. Um, and that is not the case at all.
Mm.
I just have a different approach to what I think recovery is, and B, what whose views matter in relation to recovery. And I take a much more ground up approach to recovery, right? It's not how does the medical profession define recovery, although that is useful information. It's how do communities of people who use drugs define recovery, and what do they want in order to achieve recovery, to feel better, to live in the world in ways that help them flourish. That is recovery. And sometimes that will, of course, involve drug treatment programs, medicalized and clinical settings, but it won't always involve those things. And I think that's the important part. I listened to a few of your podcasts, and your first guest on the podcast talked about sort of self-determination in recovery. It's really an important concept, not just in the kind of the way self-determination is explored in Indigenous political rights, right? Self-determination is really key to those conversations, but it has a much broader application too around people's bodily autonomy, their people's right to do what they um, uh, do what they please with their own body. This is connected really strongly to a sense of, how do people recover? How do they feel better, both physically in their body, but also in a world that's rejected them for, certain kinds of practices. And that's where I think recovery plays a role here. Recovery in terms of, what does your body physically need? And also, what do you need to kind of make your way in a world that doesn't always um, welcome you.
That's right. I think stigma is a big one. Really? That word gets mentioned in every one of my podcasts, and it reflects kind of societal's approach to drug use, and I think that's a very important thing to address. Certainly. Um, I was reading that they've obviously there are finally some grassroots showing up. There's a slight shift in policy on an international level, with the United Nations the other week stating that their approach should be more of harm reduction. I couldn't believe I was reading that when I read that. So, do you see a possible future in which the old approaches to drug use and incarceration will ever change?
I mean, I think they already are. I don't want to overstate that, right? Like, even when you have excellent harm reduction services like the ones I mentioned, there are still high levels of policing of people who use drugs. Even when you have, the decriminalization of possession in places like Portugal, and that's been expanded to many other parts of the world, you still have, significant stigma, criminalization of people who use drugs in those spaces. So I don't want to kind of paint an overly rosy picture, but that doesn't change the fact that there are strong movements to decriminalize in various different models, whether that's to de-emphasize the enforcement of drug laws or to actually remove certain drug laws in different parts of the world. That's been occurring in parts of Europe, in parts of North America, and in parts of Australia. So, these movements are afoot, and they're having successes in terms of, uh, of enacting decriminalization, setting up harm reduction services and approaches around the world. And I think it's a really important moment for us to be thinking about, um, what comes next, what comes after prohibition, not because that'll be a simple and easy path, but because we want to be prepared when and if that is a possibility. And I think there are lots of really interesting and important questions to be thinking through around, what we want to do here. We've seen some really terrible models for decriminalization, or even, the regulation of drug use, legalization or regulation of drug use, in ways that sort of promised communities that were criminalized because of drug use that they would be able to sort of reap the benefits of the commercialization of some of these drugs, especially in Black and Brown communities in America, where people have been priced out of business licenses. People have not had their criminal records expunged, which means they can't access those markets. All of these kinds of things that should be done in order to sort of undo or make up for the violence of prohibition are not being enacted, and it's sort of being passed over to um, uh, at least in the sort of cannabis space, being passed over to big business and corporations. And I don't know that really solves the problem. It's from one exploitative market, which is an underground illicit market, to, another exploitative market, which just happens to be legal and commercialized. So those are the kinds of approaches I think we really do need to be avoiding, um, and thinking really carefully about what comes next. And for me, it's always, local, or localized approaches, small kind of brewery type licenses for the manufacturing of these products, and certainly the sort of decarceration of drug use. Taking people out of prison, who have drug charges, removing those drug charges from their record, ensuring that all of those kind of collateral consequences of conviction that you were mentioning a little earlier, um, not being able to vote or not being able to access business licenses, and all of those things are sort of removed as barriers for those people to live a good and happy life.
I couldn't have put that better myself. I totally agree with every word you just said then. So thank you very much for explaining that. So we're just going to move on to a little bit about you now. So what are you currently researching?
I have quite a few projects. One I think that's really interesting is that I'm working with system impacted students at the university. So students who have been formerly incarcerated, criminalized by police, or lived in out of home care. And I'm just uh, working with them to learn a little bit about, what value they bring to the study of criminology and law, but also all of those other disciplines across universities where, um, we talk about state institutions, public health, medicine, social work, all of these places where, we talk about prison and incarceration, but we rarely ever think to ourselves, well, there might be people who have been incarcerated in this room, and the language we use to talk about these things can be quite harmful to those students. So rethinking the way we talk about these institutions, criminal legal institutions, with students, and looking at, the strengths that these students bring to our classroom, is one project I've just had funded with a group of colleagues from criminology here at the university, from the Australian Institute of Human Rights. And that's really exciting work, which isn't only about drug use, but of course there will be lots of crossovers with drug use. I'm also doing work, as I mentioned a little earlier, with clients of the Injecting Centre about their views on drug decriminalisation. What things do they support, and why? What models of drug decriminalisation do they think will work for people who use drugs, to sort of develop a sort of happy and flourishing life?
My goodness. Oh my goodness, sorry, I was just reacting to that. That sounds wonderful.
It is. It's wonderful. It's really wonderful to talk to people about, how they see the future of drug policy or what they see will work. And they have really interesting insights, not only in what they think will work, but also the politics of what they think is possible. And that's a really interesting conversation. And the last thing I'm doing is a project on media analysis of pharmaceutical dependence, so people who are dependent on pharmaceuticals, and how that coverage differs really strongly from media representations of drug addiction in other, or addiction to or dependence on other kinds of substances. And there's a really strong focus in the media coverage of pharmaceutical dependence in Australia on sort of the innocence of people who become dependent on pharmaceuticals, which is very different to the way, people who are dependent on criminalized substances are represented in media landscapes.
Absolutely, absolutely. I mean, it's big news the world over, unfortunately, what's happened with the pharmaceuticals. So, and it's interesting to see people's differing views, as you said, from legal to illegal drugs, and how that's perceived on the news and on the TV. So finally, George, where can people find you and your research?
They can find me on Twitter, or I suppose it's called X now, at Kev Detardian, KevDertadian. They can find me on LinkedIn. They can find me on the University of New South Wales website. I'm a member of the Centre for Criminology, Law and Justice in the Faculty of Law and Justice. You can find a lot of the kind of work that I do here and the colleagues that I do work with there as well.
Wonderful, wonderful. Thank you for that. And lastly, is there anything else that you'd like to mention that I might not have asked you? before we finish?
Well, I think we've had a really fantastic conversation, but I think one thing that's really interesting for us to kind of think about as an ending to this really great conversation is how we build solidarity with people who use drugs, with colonized peoples and criminalized peoples, um, uh, in order to sort of work with them to develop policy goals and outcomes that align with their needs, right? This can't just be about the way, you know, policy workers traditionally conceived or researchers traditionally conceived see these problems. It has to be about doing this work with these communities. It has to be about doing it in solidarity with them.
Wonderful. Well, thank you very much indeed for your time today. I really appreciate taking your very valuable time away from your work. And maybe we can have you on in 6 months to talk about some more of the wonderful work that you're doing, George. I've loved having a conversation with you today. I've learned so much, and reading your work has just been quite inspiring for me, and I will certainly continue to do so. So thank you very much, indeed, for joining me today on the podcast, and I look forward to speaking to you again soon.
Thanks for having me. Absolute pleasure.
Thanks very much indeed.